is located in southern Palm Beach County. So if you are somebody that you know is suffering in pain, Dr. Pannozzo is the one you guys need to call. And make that call today, because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon. And now, here's this week's edition of the Dr. Pannozzo Sports and Medicine Hour.
Good morning, everybody. I hope you're having a great Sunday. It's not your turn yet.
Oh.
Okay. Good morning, broad operator. Good morning, Mr. Centuri of AM2.TV.
We almost missed our open.
Yes, we did. And good morning to the lady that we've missed. It's the beautiful and charming Linda, who's sitting here making sure that we don't screw up. And again, always thank you to Gio, who helps this show run the way it is. And the most important person, Dr. Anthony Pannozzo. Hi, Doc. How you doing?
I'm doing fine, thank you.
Feeling good?
Yes.
I heard you had a birthday.
I did.
Well, we wished you a happy birthday. We are saying happy birthday to you all over the air. Come on.
I had a lot of emails, a lot of Facebook.
Really?
Yeah, congratulations. I guess when you get this old, I mean,
How was your trip to Arizona?
Trip was good. There was 2 people coughing on the plane, and I got
Coughing on the plane? Is that what he said?
And 2 dogs.
And 2 dogs sitting next to me coming back in first class.
Really?
Yeah.
Well, some people treat the dogs better than they treat themselves.
You think I'm joking? I'm not. These are 2 animals sitting.
Well, I beat down on my trip back from Vegas. Had a woman with a 2-year-old and a newborn and a dog on the red eye.
Oh my God!
And she had to pee every 15 minutes.
The dog?
Well, no, the lady. They give the dog like a Valium, a little Valium to make it sleep and not have to pee. 5.5 hours. Would you like to be locked in a cage?
No.
Oh, you were in Vietnam, weren't you? You were in a cage. Okay. So, Doc, I got some interesting things to talk to you about. There's a new thing now on the radio, and someone's spending a crap load of money. It's called the ab belt.
Ab belt.
And what it does is it goes around your whole waist with electronic impulses, supposedly to help build up your abs and get rid of lower back pain. So what do you think of that?
I think it's pretty much of a scam.
Yep, that's what I thought.
First of all, they never tell you where the back pain is from. Unless you know that, you can't treat it.
You don't know where the cause is.
No matter what you do for it. Building up your core, which is years ago, the core thing, remember that? Which was abdominal muscles. I figure if you do the core, now your back pain will disappear. Not true.
I know a lot of guys with a 6-pack that complain about the back. I give them your cards. So you're right about that.
We never talk about weight. We treat a lot of backache, and it's never a weight. It's always a structural ligament, actually. And we know how to diagnose it, and then, of course, you can treat it. One of the things that people got to realize is when they have a backache and they go to the family doctor, they're going to send them for therapy.
Mm-hmm.
Now, if you look at what the therapist wants to do for this person, you'll see none of it is related to backache. Unbelievable. That's where I get my opinions. They're not just out of the air. I mean, it's actual stuff I'm looking at. And you say, well, you have an L4-5 annular pain, so where's your program for that? Well, we don't have a program for that. I said, well, what are you treating then? They put them on the bicycle, they put them on weights, everything but the back.
That happened to me.
I mean, that's why I don't recommend it, because they're uncontrollable, and what are they treating? They're treating themselves, actually.
Before I met you, that's exactly what happened to me. I was complaining about, ready for this? Plantar fasciitis, which another word for that is heel spur, right?
Yeah.
Then they had me riding a bike, lifting weights. So I went to the therapist and said, I do this every day. Well, this is right. They twist your leg and they put this cream on your leg, and they have like a massager that massages the heel spur. I get up, I couldn't walk worse. I walk worse. Well, you got to get orthotics. I said, roughly how much? $450. I said, that's okay. My brother was a podiatrist. I could get them for 25 cents. That's all they cost. And here's what bothers me, Freddie and Doc. I'm sorry?
How'd you end up curing this?
It just went away.
So you limped around for a couple of months?
Well, if I would have known him, look, I go to him one shot, I'm done. I didn't know he existed.
Well, maybe the treatments were working, but it took a while, is what Freddy said.
A year?
In other words, you live with pain?
A year. It was a year.
Yeah,
you live with pain.
Yeah.
No, that's not right.
That's crazy.
So here's what I have to ask you. Okay, and Freddie, I'd like you to chime in on this also. People who have pain, why do they keep on not trying to get rid of this pain? Why do they try everything under the sun? All these things are expensive. I mean, why?
I think he's a good example, Doc.
Yeah,
I think he just gave the good example, right?
Yeah.
He lived with heel spur pain.
For a year.
He didn't know about you.
Well, I think that's why we're on radio, right?
Right.
People know you can get that stuff done. Now, that heel spur thing is a one-day treatment. That's it.
Which is amazing.
Yeah.
Which is amazing.
And fear. The other thing is fear. People not understanding that you can get cured. You don't have to go to rehab and get all sorts of 400 here and 800 there. You know, the amazing thing, you make it sound too easy, Doc.
That's the thing.
That's the problem.
You know, if you would say that my treatment is guaranteed, it's $10,000 a visit.
Or 20 visits.
Yeah, for 20 visits, and I'll get rid of your pain. Maybe,
But play cards on the other 19 visits.
I mean, I say to people at the gym, I said, what you would spend for dinner for two people and a glass of wine is more money than getting rid of pain. I mean, come on.
And pain is psychological.
Yeah, it is.
That's the other problem. You have to live with that psychological pain. But I got a pet peeve today.
Go ahead.
My beloved Mets signed a shortstop, I think, for $18 million for 2 years. That's $9 million a year, because they had to fix the middle of the infield. The guy has a sprained tendon in his knee. Out 2 weeks.
Wow.
2 weeks, Doc. Now, I know they can hear us in Port St. Lucie, because you're on 94.3 and BZT, and I know it goes up to Port St. Lucie, and they're not practicing
It goes
today.
farther than Port St. Lucie.
Yeah. So if you're listening to me, and I can't say his name,
No, please don't.
come and see Dr. Pannozzo, and we'll get you back in the field tomorrow.
And here's the thing
the
that they
next
got to
day.
know. This is not an enhancement steroid. This is one that's actually approved by all the athletic associations.
That's
You come in, you get, and you better. Why suffer?
That's right. Why sit on the bench for 2
It
weeks?
depends on the diagnosis. If they had a proper diagnosis, they would not be sitting on the bench.
Sprain, knee.
There's only so many parts in there. All the pain is on the periphery, not inside the knee. So when you have a pain, you can be sure it's a periphery.
Wow.
Around the surface on the outside, and that's where the pain comes from. Well, how do I know that? Because I know my anatomy and I read the books. That's why. No big secret to it. It's all there for you. Just read it. There's no pain fibers in the knee in any joint at all.
Get an anatomy book, and you
It's
can
all
see
in
yourself.
the anatomy and physiology of the part. So all you have to do is read it, and you'll find that there is no pain in any joint. It's always on the outside.
And you know what I've learned from you?
And why is that? The design is so good, because you never know that you're actually walking on your knee.
Right.
You don't even get a pressure on it. It's designed that way. So the pain is on the outside and is treatable, not on the inside. So if you have a pain, you never want to take the knee off. Like somebody was saying the other day that they have bone on bone. I said, it's only about 3 inches of it. That's it. You're going to throw 18 inches of knee away, a normal knee away for that.
So
You got to be kidding. These orthopedic surgeons are not approaching this right. All they do is they approach it on a surgical method. So when you're hurting so bad, you go to the therapy, and they don't do the right treatment, you're going to get worse. So where do you go? Right back to the orthopedic surgeon. This is the connection with those two. We can't break into it because they won't use us at all.
Well, another thing that I've learned working with Dr. Pannozzo, and it's an amazing thing when someone comes in with an MRI for scoliosis, you see the curvature of the spine. When you go and he does a C-arm, you see the scar tissue pushing that to where it is. But the MRI only, am I right? The MRI only shows you bone.
Well, they don't read it properly.
Right.
And if they had to read it properly, from my point of view, they'd be able to do that, but they don't.
And that's because they're not trained.
That's because they're not trained for it. So what we're doing is state of the art. It is the best you can get. And they'll say, well, how is that possible? My doctor doesn't know you. Well, he doesn't know anything.
No.
I mean, he's not trained in that. He doesn't call up. Why listen to someone who's uneducated?
See, a smart doctor, this is just because I have a lot of friends that are doctors, and they believe in what he says. One of my doctors said, why don't you tell this on the air? I said, okay, if I punch you in the eye and your eye gets swollen, you know how to treat that because we know what the cause was.
Right.
We know it's not an irritation. We know something didn't fly in your eye. We know that you got punched in the eye, and we fix it. Well, that's what you do. No doctors that I've gone to in my 73 years on this planet has ever said, how'd you get that?
Right, they tell you this is what it is.
This is what it is.
This is what it could be,
Yeah,
so they tell
I
you.
think you were walking. It was very funny. I said to him, when I had the groin injury, he said, I don't know where, and he got mad at me. He said, how did it happen? I said, no, it didn't happen from that. Where were you? I said, well, I was taking luggage out of my car, and I found the pin. He said, that's what caused it. Okay? And it was right.
Well, he told a patient in front of me that she had a back injury because she was getting migraines.
Right.
She says, I never had a back injury. Never. And then she's thinking, and I can see her thinking, and she comes up to the doc and says, Doc, you're right. When I was a young girl, I was swimming, and I hit my spine when she did the turn.
Oh,
She
wow.
hit her spine on the concrete, and they took her out of the pool. And ever since then, she gets migraines. So what you told her, even though she couldn't remember it at the time, was completely 100% accurate.
Now, this is what I call the scenario. Where it is, why it is, and what we could do for it. It's all given to you in a compressed mode, and you're actually watching the film when I tell it to you, and I point it out to you. This has never been done like this. In fact, as a matter of fact, when you go to people who treat, actually nobody treats this stuff. The orthopedic surgeon doesn't do this kind of treatment. Neurologists don't do it. Rheumatologists don't do it. They're not trained in it.
Mm-hmm.
They're trained in different things, but not what I do. What we do is unique to us. And if you don't believe it, I don't know what to tell you. I mean,
Well, we've got.
I've never been accused of not telling the truth.
I have to change Leah's advertisement because it's gone up to like 79,000 patients since
Yeah.
we've been doing this. Because we have people that send their mothers in from New York.
Yeah.
That are watching you in New York, and they're saying to themselves, I mean, the guy, no one ever calls up and yells. Oh, if you want to yell at Dr. Pannozzo, it's 800-889-0267. We answer every call because our board up doesn't know how to work the machine anyhow. So we answer every call, and he will tell you the honest to God's truth. I mean, if you're having a problem that he did and didn't work, well, first of all, you're an idiot because all you got to do is come in and see him, and he'll fix it.
Well, no, you're not an idiot. But if it didn't work, then there's a reason it didn't work, and the doc will be the first one to tell you why it didn't work, and he'll fix it.
If somebody can, you know what? No one always bothers me. No, I'll tell you why I use that term.
Tell me why you use that term.
Because people will complain about something before they go to the source of the person or persons that helped them with that. If you have a migraine headache and he fixes the right side of your neck, and then you're complaining about the left side, he didn't take care of that.
That's true.
So don't say it didn't work.
That's a
And tell
very
all your
good
friends,
point.
hey, it didn't work, right?
Yeah.
People do that. They call up and say, your treatments didn't work. I'm worse than I was. And that is impossible.
It can't be worse than you did treat the area that they had a problem with.
That is absolutely impossible. Usually there's a motive behind that. Because they know that
Yeah, they don't want to pay.
they got an impressive improvement on the one visit, and that place does not bother you anymore. So it'll be the next place. So we have a triumvirate. We have primary, secondary, and tertiary pain sources, and we mark them all down, and we just knock them off one by one.
And at the same time, just remember Dr. Pannozzo does not prescribe medication.
Nope.
Yep.
He does not. So if you're looking for pills, this is not the place. He is not a pill mill.
Nope.
Yep.
And he's not a pain management specialist in that category either.
He's not pain management.
Nope.
It's I've always that phrase is a misnomer because people hear the word pain management. Oh, I'm gonna go to my pain management guy.
Actually, it's
pill mill.
pretty accurate.
Just manage its pain.
Just a pill mill.
Actually, they're pretty accurate. They don't get rid of it. They
No, just manage it.
They give you pills.
They give you
Well,
pills.
take 4 a day now. Next week, you might come back and say it's not helping. Take 8 a day.
Right.
That's what they do. That's pain management. What do they know about the source? They do not know.
Nothing. They're cutting corners.
So people should ask all the time, what is the source of my pain? If nobody tells you, walk out of there. It's not the place for you.
I brought a very sweet young lady that I introduced you to, and she had pain in the elbow, and she said, "Oh, it's getting bad." She couldn't even lift up. She couldn't even vacuum. Now she's up there with the weights, and she's lifting.
She lifts the vacuum over her
No,
head?
she's lifting the weights. I mean, I said,
"Lift the vacuum."
That was only one day.
One day.
How long did she have that pain?
Oh my gosh! I mean,
I don't
probably a couple of months, because she's an avid. You could see what she looks like. She's a beautiful woman with an incredible. She works out with her husband a lot, and for people that work out a lot, they don't want to not be able to work out their body. You could work your legs out just for it, and then she started working. She's working out with the weights now. So I mean, we got a guy that went to. The reason I repeat a lot of stuff, folks, I know we have a lot of listeners that keep tuning in, especially in New York, and thank you so much. That went to two of the biggest surgeons in New York for knee problems. He's had that knee problems after the surgery with scar tissue that developed. You know where he is today?
Where?
He's skiing up in Denver, in his house in Denver. He's skiing up in Copper Mountain. Think about that. A guy that couldn't play golf, had to stop playing tennis, and he belongs to a country club, and you belong to one. It's expensive if you don't use the stuff.
That's true.
Am I right?
That's true.
So now the guy is doing every activity he wants, and it took you a while to get rid of all that scar tissue, but guess what? He's active.
Yeah, well, it wasn't the knee because he didn't have it.
I had no knee. That's exactly right. They took out the knee.
They took it out.
The knee was gone, yeah.
So, Doc, I don't want to be stupid or anything. So when you get rid of the knees, there's always going to be scar tissue no matter when you go for surgery.
Absolutely.
Does that scar tissue return, though?
No.
Does not return.
So once we treat it, it doesn't come back.
Yeah, it just kills it, right?
Well, it just dissolves it.
And that's amazing. I mean, imagine going for 2 knee operations and you're still in pain.
Well, can you imagine now where the scar tissue could be? It could be in your lower back, could be in your neck, could be in your shoulder. Mm-hmm. It's all ligament tissue, and the steroid we use softens that out.
That's amazing.
And 100% effective, 100%.
So a pitcher that has scar tissue from an elbow surgery, once you remove that scar tissue and he continues to pitch, and he's aggravating the area.
No, we can fix that.
But the scar tissue will continue to come back?
It will not come back. Once that range of motion becomes normal, you're done.
No inflammation?
No.
I mean, think about that.
That's amazing.
But that's why there should be no elbow surgery. There's nothing to operate there.
Well, the amazing thing is if all that occurs, and I wish that we would get I want to see somebody who's pitching right now. High school, college.
High school, elementary,
and I want to see Doc take care of him. And then
I want to see one of the coaches take one of their good guys that they need and send them over, see what I could do for them.
That's right. You got somebody who's
why
hurt.
are you holding these people on the bench? Who's telling you to do that? I mean, it's craziness.
And here's the beauty, Freddie and Doc and everyone that's listening out there. Nothing he gives could hurt you. Right. The worst thing that could happen is it didn't work. I haven't seen anybody yet come in that didn't work.
It always works.
But the bottom line is, if people fear, let me tell you something. It's less pain than getting a shot to get a tooth pulled.
Well, there must be some political thing there because these players are getting worse and worse.
Well, it has to be political.
And if they end up being operated, they've been mismanaged. Surgery is a failure to treat. It's a failure.
Well, it's funny because the NFL and MLB have come up that their players have gotten bigger, stronger. We had Rocky Johnson here on Friday on the other show. And he's even said the wrestlers in his business have gotten bigger and stronger. And the rules that used to apply in the day can't be applied today because you're getting concussions, you're getting all these injuries. But, Doc, they're looking in the wrong places for these concussions.
Yeah, yes, they are. Yeah.
They're healing the wrong section of the
these
anatomy.
are musculoskeletal injuries. And no, there are very few people around the country who understand it.
That's right. You're in a new phenomenon.
That's
well,
right.
he was the one that spoke about it a couple of months ago about the concussions emanating from the neck and the shoulders, and now they're finding out. Now they're finding out what you said months ago. Everyone said this.
Isn't that amazing?
Yeah.
But the funny thing here is that if they would have listened to you years ago, they probably could have prevented all these injuries in the game today. Because the athlete is getting bigger, contact is getting stronger. I mean, getting hit by a train as opposed to a person hurts.
That hurts. It's like getting hit by a train.
That's right. These guys are huge.
But remember, it's all treatable.
Yes.
As long as you can get the source of it, and which is what we specialize in. We specialize in the source of a pain. If you when you put it into words, that's what it is.
What amazes me about him is he feels it when you say where the pain is. He feels around, and all of a sudden you go, "Whoa, you found it." He says, "Okay."
And he knows exactly what it
Knows
looks
exactly where it is. Knows exactly where to get there. And sometimes, when he puts you on the C-arm, he shows you exactly where that is. And let me tell you something, folks. That is not a cheap machine.
Well, I'm gonna tell you, he fixed my elbow, Doc, and you didn't give me a shot. You told me exactly where to press down, which I do every morning.
Oh, you didn't even tell me that.
Oh yeah.
Listen, when I
like
put
crazy.
an X on you,
That means the devil.
Put an X on me. But he told me exactly what to squeeze.
Well, that's a signature. 2 X's.
But he almost made me cry here in the radio station.
Well, you're a baby.
No, that hurt. He touched right where it hurt. He says, "Oh, you know what that is?" I said, "Do I need a shot?" He said, "No."
Look at your
Just press
son.
down.
What you did with your son.
That's right.
Your son didn't need a shot. He fixed him by just
Didn't need a shot.
building that wedge.
But this is what I'm saying. Just because you're going to see Dr. Pannozzo doesn't mean that he's not going to treat you.
well, you don't know
The
what
right
I'm going
way.
to do.
No one knows.
I don't know what I'm going to do.
That's right.
It's
Well,
all
nobody
different.
knows what you're going to do.
Everybody's different
Everybody's anatomy is
for any
different.
reason. Yeah.
And everybody's treated differently. Don't think that because Mama San came with you and she had the same
Mama
ailment
San.
as you, it's coming from the same place. She's going to treat you differently and independently. And don't go by what anybody's telling you in terms of fixing you. He has to see you.
It's
For
like-
instance, there's a referred pain that you have to understand. Cramps in the hand is caused by the base of the neck.
Now,
Wow.
Now you don't know
Did you-
that.
did you know
have
that?
to know
Absolutely not.
You have to know the pain patterns, and when you come in with that, I go right to the neck and treat it, and your pain leaves.
You just had this today in the restaurant,
I just-
and then your neck started bothering you.
Yeah. So we do it every day in the office. You walk in there with cramps in your hand or numbness, and we know exactly.
I
what
got
it
a
is.
question for you. Every week you're studying the anatomy, correct?
Yeah, right.
Looking for that nugget of gold, so to say.
Oh, I like that.
Did you
Freddie.
find anything different? A new source to something? Did you stumble on something?
Yeah. Well, the migraine, of course, we know where that's from, and the vertigo. It's from the same place. Now I'm working on ringing
In the ears?
in the ears, and I think that's from the same place. Anyway, we had a guy who works in the baseball industry. He's a catcher, or coach. I mean, a referee, and
An umpire.
an umpire, and he got hit by a ball, and
It hurt.
He was hurting.
Oh, yeah, it hurts.
So he came in, and he's the guy who turned the TV off while you were there.
Oh, yeah. When I was there, he said the sound is too loud. He shut the whole TV off.
I would have told him, you're ready.
But he walked out.
You're out.
He walked out pain-free.
Yeah,
Really?
Yeah.
I was there.
It was just a one day.
Okay, Doc, you got to get me his number. I got to call
He
him.
has
Yes.
not been back. His name's Becker.
Yeah.
Yeah, but you gotta give us
So
a
you got to
phone
give me the
number.
number. I'm going to go see Mr. Becker because he's around baseball players.
Yeah.
And I can go talk to him.
I'm gonna make a note, Doc.
Yeah,
for
make
you
a
to
note.
see
Let's
Becca.
get Mr. Becker on the air, and let's talk to Mr. Becker because this is baseball season, baby. It's coming. It's time to get some of these guys. And I can tell you, there's a flood of professional athletes right now not playing.
Yeah.
A flood because of nicks, knacks, and it's all these tendon tears. And
Well, they're going to tears. There's no such thing as a tear. A sprain, but not a tear. Anyway, they're going for names. Big names like that. Our friend who went to Denver. From here, went to Denver to get operated on his
Because
knees.
these were
I mean,
supposedly
crazy.
the best. They took his knees out.
I could take your knees out, do it for $1.50.
Yeah, well, that's what you guys did.
That's what I told him. I said, everybody's
Italian
trained the
guys.
same. What makes this guy so special?
I'll use a baseball bat to fix your knees. How's that?
That
We'll move
works.
you on real quick. All right, why don't you give out the call-in number? Because I feel like it's going to be a call-in coming in.
Okay, 800-889-0267. That's you can call us up on the show
What number
now.
was that last? You said it too fast.
800-889-0267. You can call up Dr. Pannozzo on the air, ask him any question. We have a whole bunch of questions from my hometown, New York. You want to take a couple questions,
Yes,
Doc?
yes.
Let's go. Well, first I want to ask you, there's a new thing out. It's called emu oil for pain. What's an emu?
That's a deer, like an antler.
Is that an emu?
Emu? I thought there was a
I don't know what
bird.
that
That's
is.
a bird.
That's a
Emu's
bird.
a bird.
Well, they have you rub this oil on you, and it's supposed to, ready for this, get into and under the skin and go directly to where the pain is and get rid of the pain. not forever. Relieve the pain is a key word they use. You want to be relieved? You want to be cured?
I want to be cured.
Okay.
What about in the Super Bowl when Ray Lewis, they accused him of using antler oil? The antlers on the deer have an oil.
Yeah, but that's not.
It's banned.
Are you serious?
Yes, because it has a steroid. It has a steroid. And it's banned.
He's back, folks.
Holy mackerel! Look at this. Linda found the emu oil.
What is it?
1999 at Vitamin World.
It's from free-range birds.
Oh, wait. Look what we got on the phone, guys.
Free-range birds. You're right, Doc. Congratulations.
Ready for this? This is a stunt man, Buddy Reynolds. Hold on. Buddy Reynolds is a stunt man. Hi, Buddy Reynolds. How you doing?
You're on the air.
Yeah, I'm doing good. It's so good to hear somebody doing the work, and these guys have lied to you so much through physical therapy, and I've had 4 ACL repairs by some top NFL surgeons, and they never got any better. And I started doing this work and working on stunt guys that had all these great surgeons, but they weren't getting any better. And your principles they're right on, of course. I'm not telling you anything, but I'm tired of seeing the problems within physical therapies that just put you and take your money away.
Excellent.
I mean, it's ridiculous what they do to people. And I worked with a chiropractor for 10 years, and I would love to work with these guys 3 months after PT, and I'd put them out of their pain within 1 or 2 treatments. I had a great story I want to tell you real quick about one of my clients that came to me. We went to a podiatrist with all this foot pain. He was walking with every step pain for 2 years. And he comes to me, and his wife says, can you help him? I said, well, if I feel what I feel, I said, yeah. So I did this work on it. They said it was heel spurs and all this other stuff. And so she comes in to see me, and he's a doctor, engineer, and I work on his feet. And I knew that, he had all these expensive podiatrist stuff, and it didn't help him. And I work on his feet, and he comes out of my room with 15 minutes of work, and he goes, buddy, why don't doctors know what you know? I said, what I do is simple. Well, anyway, he goes, I have no pain in my feet. I had pain every step of my last 2 years. His wife comes in a week later, and she goes, buddy, I went into the kitchen, and there was my husband doing something he hadn't done in years. He was dancing. And this is starting from chronic pain from this treatment with soft tissue and connective tissue. And it's just amazing that these people are told that, they need these surgeries, and they don't. So God bless you, man. I love to hear this work. I'm looking to open up my own place called Pain Eraser because I love facilitating people to get out of pain and think they would never get out of it. So thank you for your work.
Thank you, sir.
Excellent.
Appreciate it. Thank you so much.
Stay on the line. We're going to get your number. We're going to call you after the show.
Okay.
Okay.
All right. But don't hang up.
I didn't
I
still.
won't hang up.
Okay. All right. All right.
Hi, who's this? Hi, everybody. Who's on the line with me? No one? Okay. All right, Doc, let me start. Wow, that's amazing. People
Well, it goes to show you that he's agreeing with you, saying that.
Well, it was a self commercial, is what it was.
It was. But that's okay, because the bottom line is he can relieve you of pain, which is what he does. But we're going to talk to him about getting rid of the pain, and we'll go from there.
Okay, we can get some calls. From Tina from New York City writes, I was watching a show on Manhattan Cable, and I noticed that you say flat feet can be fixed. Does that mean if I have flat feet, I can gain an arch? I'm a hairdresser, and I am on my feet 12 hours a day. The pain in my hips and legs are unbearable, and I will be in Boca Raton next month. I'm coming to see you if you can help me. Okay?
But that's interesting.
Sure.
You get your arch back.
Yes, no problem.
So let me, Tina, so when you come in, let me give you Dr. Pannozzo's number so you could...
Now, we never want to get a foot operated at all. Ever.
Correct.
Why? You need the mobility. And there's many parts. They're all connected by ligaments. And if you know how to do it, you can get that arch back real fast.
Okay, so let me...
And so she'll be coming to the right spot.
So let me tell you this. If you want, get your pencil out. It's a 561-381-5800. And I appreciate that if you do call Dr. Pannozzo after 12 o'clock. That's 561-381-5800. And guess what? You're going to walk in with a limp, and you're going to be leaping out. Okay?
Hey, Doc, I got a question for you. Is there a tendon that affects flat feet at the bottom of the calf that creates pain on top of the foot if it doesn't stretch?
No, that pain is probably from the lower back.
From the lower back.
Yeah, see, where it goes tells you where it's from. Unless you know these pain patterns, you'll never pick it up.
Wow.
This
It's amazing, yeah.
So you can have pain all the way from your lower back into your calf that goes to the top of your foot?
Absolutely, yeah.
Well, look at Leah. Leah came in with a pain in the ankle, and he had to walk, and she was going to go get the boot and the surgery, did this and that, and drugs.
Well,
and,
it's all from the same area.
yeah, and
And this is why we tell people to call
that's
after
what we
the
tell
show.
them to call after 12. Thank you
That's
very
okay.
much, but we
That's
don't
all
care.
right. We'll get back to you.
We'll
That's
get back
all
to you.
right. We'll get back
As soon as the show is over, we'll be going. And he had to walk up and down and said that it's in your back. Now, if we would have gone to a podiatrist, which he was going to if this didn't work, and they would have suggested physical therapy and orthotics and that, he fixed it in one shot, one day. And that was over 2 years ago, because that's when we first started with Leah 2 years ago.
Right.
All right, so it's real. It's not Memorex. It's real. Okay, another one from New York, Doc. I heard that you held a seminar a couple of weeks ago, and if I had known, I would have flown down to see you.
How did they hear that?
I know. They didn't get to hear it.
Just read what they sent in.
Well, you get new listeners every day. That's the problem.
My problem is that I have been told I need surgery to replace a bulging disc in my lower back. The pain is so extensive I can't tie my shoes. I saw your show on MNN, Manhattan Cable, and I was shocked that you say bulging disc does not exist. I am so happy that you say that, but if I have you to work on me, how long will it take for the pain to disappear, and how long does it take for me to have a normal life again?
Well, one of the things that is significant on this note is that she can't bend over to put her shoes on.
Yeah.
Right.
Tie her shoes.
Well, that means it's not the lower back. You see?
Okay.
So there's another activity there that would be treatable. And then the lower back, anybody who has a bulging disc doesn't have anything.
What is a bulging disc?
It's a sprain.
Oh, that's it. Okay.
Does it really bulge out?
No. It's stretch. It's an
stretched out.
overstretch phenomenon. Yeah.
Okay.
And you
That's
go
what
in
a
there.
pain. That's what a pain is, right?
Yeah, right.
Failure to stretch.
Inability to stretch
Right.
is what a pain is, plus other things, and so you have to know that. So you're looking for a ligament.
Okay, so let's stay on this for a second. People who have been diagnosed with bulging disc here in Florida, let's say,
Right.
if they come to see you, they may be shocked to be made aware of that it might not be that particular area. It could be something else leading to that area.
Well, you can't. That is not a diagnosis. You see, so you have to know. What do you mean bulging? Bulging of what? Where?
Where did it come
Which
from?
side?
That's interesting.
Why? That's what you get in the scenario that I
Right.
give you. I give you the whole thing. You know what happened to you, where it is today, what can be done about it. And once you understand it, you see it in front of you on the film, which is a special film we do. Then it makes sense, and then you do it, and you get the result that we predicted. But that's what you're after. You're after this scenario. Why it is, where it is, and what can do about it.
That's right. So don't be misled into thinking bulging disc means that's
Doesn't
the area.
mean anything. Nothing. So you
that's
want to ask
important.
which
It is
bulge,
important.
which is bulging and which side.
That's
you never
right.
get that.
And
from
what's
an
making
MRI.
it bulge? Or bulging what?
You don't get it. No.
Very good point.
I would say.
Very good point.
So again, if you're there, we want to tell you, Judy, you can call up Dr. Pannozzo at your convenience at 561-381-5800. Make an appointment, John, and I'll tell you, you'll be amazed and happy.
It's worth the trip down. Where is she from? New York.
New
New
York.
York City.
Okay, now Linda writes from New York. I always like to get the New York people out because they get mad if you don't give them first. Linda from New York City writes.
Because you're two boys from New
We're
York.
two
You
boys
should
from
know.
Brooklyn, baby. Linda writes, my son wants to play tackle football next year. He's only 8.
This one had a.
Ooh.
This one was tough.
My son has scoliosis and can't play right now. I saw your show and want to tell him that maybe there is a way that he can get fixed and ready to play next year. I wanted to hear from you and will be watching today before I build up his hopes. This is a condition which is severe, could be addressed and corrected hopefully by seeing you in a year. Does his age make it more difficult?
He's 8 years old.
8
by the
years
way,
old,
Doc.
wow.
No, his age makes it easy.
Right?
Yeah. The older you get, the more scar tissue you get. tougher.
Okay.
And so an 8-year-old doesn't even need that much. We can fix that in a minute.
So if that person has been told, I just want to get this scenario. If that person was told that they need the cage, he'll never be able to play football.
No.
Oh, no.
Okay.
You don't want an
No.
8-year-old operated
No.
ever.
But
Not even a 20-year-old.
No, not even a 40-year-old. I mean, why go
Nobody.
for? That's got to be a painful surgery.
Nobody. I mean, there's places doing thousands of
Oh
operations a
God,
year.
yes,
And it's terrible. It makes me sick.
Well, Doc, the other thing I want to point out, because the gentleman is listening today, is that once he comes to see you, it's not going to take overnight. He's going to have to come see you
no.
for a number of visits. But once that happens, structurally, this child's back can take the pounding of playing.
Yeah,
at
once
his age.
once the curvature's out, he can do it. Yeah.
He has no problem being tackled or making
No,
tackles.
I had
point.
when my 8-year-old was playing the same thing. We fixed him, and
And he was able to go play.
yeah, because it was good for him to understand. But I could also take care of the pain, though.
Yes.
It's a big difference.
Well, the
He
deal
is now a
here.
doctor in Phoenix.
Well, the deal here, Doc, is that this child, you're giving him an opportunity to do something that he gave up on.
Yeah,
That's why
whether
the
you
father's
want-
being careful.
Right, confidence, self-confidence will be back. I mean, the kid will just flourish. I mean, this is the proper age, 8-year-old.
Oh sure.
You first thing you know, you're 10 years old, then you're 13 years old, and it's just,
And then you wake up one morning, Doc, and you're 73.
Well, you wake up one day and you're playing in the NFL.
Very possible.
You don't know. But without this happening for the child, he has no shot.
No.
you know, when I was raising my family, I did anything I could do to facilitate their future, and that's the way you have to think. You can't
No.
say, well, it's going to cost me X number of dollars to go to Florida. That is not the issue. You can always make payments on your credit card. That is never an issue. Money is never the problem.
Not
You
with-
know what it is? Expertise. Not everybody has the same expertise. And unless you understand that, you can't justify the costs. See?
That's right.
I
But
think,
we guarantee the work. I mean, you come in my office, I'm going to guarantee that work, and we film it for you, before and after.
and that's something that lasts forever.
It
I mean,
does.
you could go to Pannozzo.tv and look at some of the scoliosis patients that he's seen. Let me spell his name so you can look on it correctly. It's Pannozzo, Pannozzo.tv.
That's right. And the bottom line here, Les, like you said, he's not only going to help this child do something that he's always wanted to be able to do. Maybe that's why he wanted, because he know he can't. But you're going to change his future. Not
And his
only
life.
his present, you're going to change his life.
Yeah.
His
Yeah,
outcome.
you never want to put screws in the back.
Absolutely not.
Or rods, because it's not the way to go. Here's the philosophy is wrong, as far as I'm concerned, about these orthopedic surgeons. They want to put the screws and rods in there to prevent it from getting worse.
Not better.
That's not the idea. The idea is, how do you improve it? They don't approach it that way because it's not surgical. So you got to be careful who you're taking your child to. And if they do a lot of surgery, you want to get away from that person.
And it's worthwhile just to come down and talk to you.
Oh my God!
I mean,
Absolutely. When it has to do
I
with
mean,
kids.
you have a kid that might be turn out to be an 80-year-old. What does he do the rest of his life? You're curing the kid. You're doing the best you could do for your own child.
And you're looking at close to $125,000-$150,000 operation. So let me ask you: as you get older, when you do the cage, when you get older, do they have to take it out and put a bigger one in because your body is getting taller?
No, that's the problem. Doesn't
It
work.
grows. It doesn't stretch with you.
Cannot.
Yeah.
It
So what
cannot.
happens if I'm 8 and they do this thing? What happens when I'm 18?
Oh, well, you see, a lot of times they use screws only now. They don't use the rods or the plates between the.
Yeah, I
the
saw
screws.
that. In
Yeah.
Germany, they're doing that thing with plates between the spinal.
Well, that's an improved thought,
Yeah.
but it's still not the right one.
Still surgery.
But it's still
Still
not in the right area, Doc. This thing's pushing the plates. It's pushing it to the left and to the right.
Yeah, that's true.
Come on, let's be real. Let's call it what it is. It's
Now, how
just
do I
bad
know
medicine.
all this that I'm talking about?
Yeah, I've only been
Because-
doing it for 55 years.
Because I see the patients who had the surgery, and they still have all the pain.
Yeah.
And I have to learn how to take care of it, which I did. That's why we can talk about it.
What's also amazing is that you were able to, being a medical doctor, graduating from Ohio State University and going into this field of pain and musculoskeletal medicine, which no one except you and his son. I've never heard of this until I met you. I've always when you explained to me the difference between what you do in pain management, you don't want to manage a person's pain. You want to get rid of it,
Right.
and that's a very big thing, folks. You got to read between the lines.
Now, I'm going to give you the most amazing thing.
Go ahead.
And this is all honesty. And I know that we do the show with Dr. Pannozzo every week and everything else. This is the only man that I know. He doesn't put commercials in this show. He doesn't get sponsors for this
No.
show. He's a self-reliant. He does it because he really believes in what he does. And that, to me, means everything in the world. Hold on a second.
Okay.
If I was a parent that wanted to play sports, or if I was a coach, all my players would come down to see
Oh
you.
God, yes.
All of them. All 18, 12, whatever it is I have on my team, and you check them from head to toe. You give them a check. They move on. This one has a problem, and we talk to the parents.
Because you understand what the man does.
Because it's about taking care of the body. You can't have kids do things
No.
that they shouldn't be doing.
Right.
Okay, guess
And
who's
you
on the
can't
phone,
listen to the
Doc?
kids because they'll want to do it.
Of
they
course
just
they wanna
don't
do
get
it.
the idea of the future.
That's right.
Barbara, hold on. We're coming to you right now. We've got Barbara on the phone,
you.
Doc.
Barbara, you're on the air.
Yes, okay. This is Barbara Massetti. I'm calling from Delray, Florida. My question is, I happen to be a nurse. I had a fracture of the right shoulder 7 years ago, and I'm still experiencing chronic pain. I am in physical therapy. My other therapist said that he couldn't see me anymore because it would be the same what's the word I want to use? Same therapy. So he sent me to Landline Physical Therapy in Boca. Now my question is for this chronic pain, what can be done? Should I come in to see Dr. Pannozzo?
Well, here's Dr. Pannozzo right now. He'll
Yeah,
tell you.
well, absolutely, because the exam we do is a medical exam and treatment. You've been going to technicians. What makes you think you're going to improve by that? It doesn't happen.
Well, I know. Well, the fracture occurred June 21st, 2009. Dr. Jonathan Levy of Holy Cross Hospital operated on me, and since then I've been in quite many times in therapy. I went to select physical therapy.
Yeah,
Boca,
but you have, listen.
I'm just trying to feel better.
Okay, listen, you have scar tissue there,
That's what
and
it is.
it's treatable in a different way than what you've been getting. So we guarantee you result.
Yeah.
But
The pain stops here, Barbara.
trouble with the shoulder is it continually gets worse.
Yeah.
Unless you do the right thing for it.
That's right. All the physical therapists in the world are not going to get that pain out of there, Barbara.
Well, Barbara, I'll tell you one thing. Everyone here at the station that we're at, myself and my co-host, have been to see Dr. Pannozzo, as well as a lot of the people that...
Oh, I believe it. That's why I happened to get the number. I listened this time. Last time I listened, but I didn't get the phone number, but today I did.
Well,
okay.
listen
I
this
want
time,
to come
Barbara.
to the office. I have insurance.
Okay.
And hopefully you can make me better.
Barbara,
Oh, well done.
no,
First
we
visit,
will.
you'll be better.
you'll be better, and you play golf, Barbara?
No.
You'll be taking golf up after you see him.
Absolutely. We guarantee
I'm a
you're going to be much better.
retired registered nurse here.
Okay, well, we'd be very happy to see you. Just call in tomorrow and we'll give you an appointment.
Let me give you the number, Barbara, in case you don't have it. His direct number is 561
Yeah.
381 5800. And when you finish with him, you go right across the street to Walmart and be shopping all day. You won't have any more pain.
No, what I want you to do, Barbara, when he cures you, I want you to go see your rehab people and throw a bowling ball at them and say, hey,
She'll be able to pick up the bowling
Absolutely. And you're going to say, guess what? You guys are really something.
Yeah, well,
else.
they're uncontrollable. They don't have a program. They won't take orders. They can't do the necessary work. And
Well, I left a message, by the way, Doctor, the other number, the 561-381-5800.
Yes.
Yes.
And I got a 623 number it goes to.
Well, 623
Yeah,
is...
that's my Arizona office, so you don't want to call that one.
Yeah, well, no, we'll get to you. We'll get back to you.
Yeah, okay.
All right.
I'm looking forward to coming in, and I don't have to go to physical therapy. As I said, they consider this, from their diagnosis, a chronic pain. The rotator cuff is weak.
Well,
So-
that is not true.
Yep.
And chronic pain only means more than 6 months old. That's all.
That's all it means. Just words, Barbara.
It's a time element.
Boy, I've had so many
Oh,
people...
what does it mean? I didn't hear you. What does it mean?
It's a
Chronic
time
pain.
element. 6 months or of pain or older is a chronic pain, but it has nothing to do with source.
Yeah. They're just throwing a whole bunch of words at you, Barbara. Don't worry about
Right,
that.
right.
The doc will take care. He knows exactly where to
Right.
pinpoint your pain.
Right,
He'll take
right.
care
I'm
of
so
that.
glad I got the number this time.
And make
I
sure
want-
you come in tomorrow so you can call us up next Sunday and tell me how good you feel.
That's right. You can call us to give us an update.
But I need to know your address in Delray.
Go ahead,
Where I
Russ.
go.
16244
Yeah.
South Military Trail.
South Military Trail?
It's south of
Okay.
Linton Boulevard in Delray, and it's Suite 740.
Okay, Doctor, sorry, it came through a little bit muffled here. Can you repeat it? I didn't know if you said military trail.
Military
Or,
Trail,
uh,
South Military Trail.
16244?
Yes.
Yes. Right across the street from Walmart.
Yep.
All right.
From
Ian?
Walmart. Oh, I see those buildings. There's medical buildings there.
That's
That's right.
That's it.
That's it. All
Yeah,
right.
right.
Beautiful.
Is there an eye center there, I believe? Somebody's
Yes.
a doctor's over there.
Yes.
Yeah, 16244.
Yep.
Okay, I'll write this down. And what time should I come in?
Well,
mean,
tomorrow
Open your book.
you can. I'm looking at my book in my brain.
Right.
You can do it about 11 o'clock.
Gee, that's when I have I have another appointment. What other time this week? Tuesday?
Tuesday, you can come in at 11 o'clock.
Tuesday at 11.
Yeah.
Yeah.
Could I make it a little later than 11?
Whenever you can, honey.
Yeah, 12 o'clock.
12 o'clock is fine.
Yeah, okay. 16244 South Military, and I'm thinking of that eye center there. Who's over there?
Yes.
There's
It's-
one-
it's
Well,
a
it doesn't
second yellow
matter. Just
building.
go to the right address, Suite 740. It's right by the fountain.
You can't
in
miss it.
front.
16244.
Yes.
Okay,
Thank
very
you, Barbara.
good. So I'll be in
Thanks.
Tuesday, okay?
All righty.
Yes.
Looking forward to it.
All right. Thank you. And there you have it. And that's interesting because she's being sent from
Therapy to therapy. You know, they don't use.
And you notice how he goes, I can't help you anymore. I got to send you to another therapist.
They
Isn't that the funny thing?
see. They're all after the money. Now, here's the deal with these people.
I can help you. I'll send you my friend Harry.
As long as
She
you
has
go to
insurance.
them and insurance pay for it,
Yeah.
you're never going to see a doctor. Never. You'll go place to place, and they'll bill the insurance company ad infinitum until you're dead, and they will keep doing that.
And they'll keep paying.
And they don't refer to physicians.
But what's
And
funny
you
is,
say,
Doc,
well, what, you're supposed to be working with the physicians. We're the ones who trained you people.
Yeah.
But they're so big, so many of them, that they have clout with the Congress. So that if you have Medicare, they'll pay for that.
Mhm.
And if you're for instance, if you're in a nursing home and you don't have physical therapy, Medicare will not pay.
unbelievable.
That's how much clout they have. No matter how many doctors you have on staff, unless you have physical therapy under contract, they won't pay you. Now this is wrong. I mean,
Yeah, of course it's wrong.
Who's leading the show here? Insurance companies are leading the show. They'll pay what they want to pay for, and
But-
that's it.
But what Freddie said, the one therapist couldn't fix it. They said to another therapist.
And they changed
And they keep changing. I mean,
and they
that's
changed
right.
the words.
Yeah.
Now it's a rotator cuff.
Right.
How many people did I bring in that had rotator cuff injuries and they walked out in 5 minutes? They
No
said,
rotator cuff.
Yeah.
It's supraspinatus tendonitis is what
That's
it's,
right.
what's the proper name
So
for
he
it.
says, super spaghetti spendonitis.
So I think you get that from eating too much pasta,
That's
right?
right. That's a pasta disease.
Well, I got two Italians here. I'm outnumbered here. Wenda, you're not Italian, are you?
No.
All right. Me and Wenda against the two of you. Oh, we got 3 Italians here. Whoa.
You're not Italian. Holy smokes.
Holy smokes, is right.
Let's get another one, Doc. You don't mind answering questions today, do you? Kelly from Miami writes, I saw that you cure migraine headaches and that Botox should not be used. Oh, yeah. I have used Botox and now I'm afraid that I may have caused damage into my head. If I went to see you, my migraines will be treated. Does Botox have any lasting effects in my body?
No,
No.
Can you OD on Botox?
no.
It just doesn't cure you.
Well, I had a friend of mine that did it, and she said it cured her, but it came back.
It doesn't cure if it comes back.
It doesn't cure it.
No.
But I don't even believe it dissipates it because she has migraines again. I think she's always had it.
Well, they don't know.
Well-
when you go to somebody who's going to use Botox on you, they do not understand source of the symptom. A headache is only a symptom, and you have to know where it's from. And it could be compound. You could have 3 or 4 places in your neck causing it.
Well,
you have to take care of each and every one.
while I have Kelly,
Well, it's the first time I've ever heard you can get a facelift and take care of your migraines.
well, get a facelift to just get the wrinkles done. Kelly, I can tell you this unequivocally. I brought in someone who suffered from, you like that word, didn't you, Freddy?
On who?
Unequivocally.
Well, you guys are using big
I'm
words.
telling
today.
you, and I'm not even a doctor.
Oh, you
Want
should.
Unequivocally.
Oh my God, is that correct?
Yes.
Jeez.
Here's what it is. I brought in someone who was in her 40s, who suffered from migraines, TMJ, and vertigo. She didn't want to come, but I said, "This is your last shot." Botox up the yin yang, ended up being rushed into a hospital in Miami because of a jaw locked up. As I'm bringing her in to meet Dr. Pannozzo, here's a woman that's 65 that just had the shot for vertigo and migraine, and sat with this lady for a half hour. I missed my lunch because of that. Telling this is the only guy. They went to the same doctors in Miami who claimed to cure migraines. Both of them never came back. Not because.
Have you ever heard from them again?
Well, I see the one in Starbucks. She always says, "Wow, it's amazing, 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 amazing."
Yeah, we're virtually 100% cure rate for migraine.
Much cheaper than a Botox injection for $1,500 each vial.
And it's paid for by insurance. By
They
the way.
treat TMJ with Botox?
Yeah.
How can you do that?
Well, you can't. That's
It's
why
unconscionable.
I mean,
There's
that's just
no-
retarded.
There's no ethics
No,
there.
it's absolutely no ethics because you can't cure it.
This is bad thinking.
It's bad thinking. That's correct.
Here's what I'm trying to understand. I think like someone might have come in for something on their head, like wrinkles, and the doctor gave a Botox shot, and he said, "Oh, I don't have any more headaches, doc." I don't know how Botox related to headaches.
How did they decide to use Botox?
I'm trying to. I can't.
Well, they think tension headaches are because of muscle strain.
Oh.
And so that if you use Botox on the muscle, of course, it relaxes for a while. And people will report anything. I mean, you get a questionnaire. And that's why when you get your toe treated, they put down the medication does not produce headaches. You'll see that on it. You say, what does that have to do with anything? It doesn't. It's just a question that people have to answer. And has no relationship to anything. You have to have a source. You can't just do that. I mean, it's
scary.
It's scary what
It really
goes on
is.
out there. That's
Really
why we're doing this show.
And like
I mean,
Freddie
you know.
said, as you can see, folks, we have no sponsors. Dr. Pannozzo is paying to give
He
people
does it
the
himself.
opportunity,
Yeah.
and this is his only real day off, to let people know. I mean, he cares. Yeah, I mean, when you come in, you can't believe how inexpensive it is to be cured. I guarantee you, one therapy session costs more than getting rid of a headache. The reason I'm so passionate about this is I suffer from a groin problem that was fixed in 2 shots. Okay.
That was amazing because you don't
Yeah.
go see a doctor for nothing. I mean, you don't go get shots for nothing.
Yeah, I mean, I could go. Yeah, I could go. I have a good friend who's an orthopod. I like that word. And
Okay, that's it. Enough for the words. Hey, Doc, I heard a rumor that perhaps in the near future you're going to be doing a reality show.
yes, a reality show.
We're hearing rumbles in the jungle.
Yeah.
Oh, that's true.
Watch out, Kardashians. The man is coming. Watch
The
out, Duck Dynasty. We're taking over.
the feature for this is a scenario what I described to you.
Yeah.
So you'll see the symptoms. The patient will talk to you. These are real people, by the way. And then we show the exam, how we do it, and then we read the scenario. And then the last piece on this particular person is coming out of the treatment room, and in 2 minutes, 3 minutes, their pain is gone. And it does not come back.
It's amazing because this show is going to highlight exactly all of the things that could be wrong in the medical profession today. I'm not
Yes.
saying that it is. I'm not going to let the cat out of the bag.
No, we're not. We're gonna have a lot of athletes that are gonna be coming on the show
we
too.
have a lot of athletes that
We're
are already
excited.
contacting us that want to be involved in this thing, from what we understand. And this could be very different.
It's
Yes.
going to revolutionize pain treatment.
It's going to have the doctors going, huh? Huh? What is this guy
How
trying
did
to do?
he do
huh?
that? How did he do that? Well, you have to have the right thinking and background.
Well, you have to have 54 years of doing this. You have to have a musculoskeletal background, and you have to have a physics background. And you know what? That's a lot of schooling and a lot of smarts. So
And the people involved in this show are going to be somebodies, and everybody's going to go, holy smokes, how did he get them to say that? Well, it's the truth.
Well, it's the scenario, and in other words, in order to do that, you have to have a proper diagnosis, because they're going to see you 10 minutes coming out of the treatment room.
That's right.
And the one thing that he does, which I always love, he says, I want you to reproduce that pain.
Yeah.
And the bending and the
Listen,
picking
I
the
don't know how
legs
to
up.
do that. Well, I read it to him. I say, bending backwards produced your pain. You don't remember that?
That's right. But you can't remember the pain because you don't got it no more.
I remember when the golfer came in, he got the 2 shots, and he said, okay, swing the club. The guy's going all the way back. He said, nah, this can't be right. Hold on a second. He tried everything to make that pain come back. He was one of these stubborn guys.
He couldn't get it done.
Came back the next week and said, Doc, I happen to always be there when they come back, which I go to have lunch, but what can I tell you? And you know what the guy said? Doc, it's the best golf I've ever had. Because it's real.
We remember
It's
the
real
guys
and it's
who
true.
come in from Adios, the country club. He had to go to California
Right.
to play in a tournament, and he was bent over. So I gave him his shots, and he went and played 18 holes the next day in Los Angeles.
Say goodbye.
Goodbye.
Goodbye, everybody. Thank you so much for listening to Dr. Pannozzo. I know it went fast. 561-381-5800.
See you next
Thank
week.
you, Mr. Freddy. Thank you. I don't even know her name. Bye, everybody. We'll see you next week.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pannozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings you more important information on the physics of weight-bearing and engineer concepts for the body.